EMT Sam, this station here is designed to test your ability to perform a patient assessment on a patient of a medical nature. You've been dispatched to a call for a 65-year-old female who's unresponsive on the floor. When you are ready to begin, you may start.
Okay, PSI, is my scene safe?
Scene is safe.
Okay, I am responding to an NOI. I only see one patient. Is there a need for additional resources at this time?
This is a NOI. This is a 65-year-old female who a family member says she was on the toilet bowl having a bowel movement when she became unresponsive, and then they laid her on the floor, and then they called 911.
Okay, so my general impression, 65-year-old female found supine. Because I don't know what happened, I'm gonna have my partner manually stabilize C-spine before I check responsiveness. Ma'am, are you alright? Are you okay? I'm gonna tap the shoulders. Ma'am, are you alright? Okay, my patient responds to pain. Okay, I'm gonna have my partner open the airway with a modified jaw thrust. Do I hear any gurgling? See anything?
Nope, you hear no
suction?
gargling sounds whatsoever.
Okay, so I am now going to attempt to apply an OPA. Okay, I'm gonna measure and apply the OPA. Does my patient accept the OPA? I'm going to remove that anatomically, and now I'm going to suction my patient's airway, suctioning on the way out. Does that suction clear that airway?
Airway is now clear.
Okay. I can attempt an NPA. Do I see any signs of facial?
Unknown if there's any facial or cranial trauma.
For right now, I'm going to just have my partner maintain the airway with the modified jaw thrust right now. Is my patient breathing?
Your patient is breathing.
Is she breathing adequately?
Your patient is breathing adequately. She's breathing about 20 times a minute.
Okay.
And it seems to be adequate, deep, rapid respirations.
Okay, can I get a pulse ox on her currently?
Patient's pulse ox is about 93%, 94%.
94? Okay, because my patient's pulse ox is under 94, well, 95. I'm going to apply oxygen in a rebreather at 15 liters. Just gonna. Okay. All right. Now patient has oxygen. I'm going to take a listen to lung sounds. Okay, I hear wheezing bilaterally. Is that what I have?
That is correct. She is wheezing bilaterally.
Okay, I'm going to take a look, see if there's anything to seal or stabilize in her chest. Do I see any open wounds, any impaled objects?
You see no open wounds, you see no impaled objects, and there's nothing right now currently that you notice in her chest that you need to stabilize.
Okay, I'm going to palpate down the clavicles.
It's intact, chest wall is intact.
Intact. And the rib cage?
She has equal symmetrical chest rise.
Okay, great. Now, I'm going to check for major bleeding. Do I have any blood behind the neck?
No major bleeding noted.
Blood behind the back?
When you look at your hands, you see no blood.
Behind the knees?
No blood.
And behind the ankles?
No major bleeding.
Okay, I'm going to check color, temperature, and condition of her skin.
She is cool, pale, and clammy.
Okay, and bilateral radial pulses, are they present?
They are present.
Okay, all right, so I did that.
And the quality is weak and rapid.
Okay, perfect. So my patient is on oxygen. I'm going to determine that she is a high priority because she is unresponsive, and this is an unknown NOI. I'm going to have my other partner get ready to package and transport. While he does that, I'm going to do a quick rapid assessment. I'm going to assess the head and the face, the spine. I'm going to check for JVD.
No JVDs noted.
Tracheal deviation.
Trachea is midline.
Okay, I'm going to palpate the chest again.
Okay, chest wall is intact. Equal
Okay.
expansion.
All right, at this time, let's take a listen to lung sounds again.
How many times at a minimum? Present.
Still have wheezing bilaterally.
Okay, so on your rapid assessment, how many times at a minimum you will assess lung sounds?
Four spots. Okay, now I'm going to assess the abdomen.
Soft and non-tender.
Okay, I'm gonna check the pelvis. I'm gonna push in and down towards the ground.
Pelvis is stable.
Okay, 1%. Do I have any sign of incontinence?
No incontinence noted.
Okay, I'm gonna check both legs for symmetry.
Intact and the same. Same.
Okay, I'm gonna check pulse individually.
Pulse is present.
Okay, because she can't respond to me, I can't ask for a motor and sensory, but check the same. Pulse is present.
Is present.
And do the same for the upper extremities, symmetrical. Check individually. Do I have a pulse?
Pulse is present.
Same thing here. Do I have a pulse?
Pulse is present.
Okay. So before we transport her, I'll take a look at the back, but I want to get a set of vital signs
Okay.
first.
We'll go ahead and just, partner's still packaging, trying to get stuff that he needs. He's down in the elevator, it's a little delayed.
Okay.
Since your patient is pretty much somewhat stable, what will you do now?
Right now, I'm going to, before we leave, I want to see if I can obtain a sample from anybody. Do I see any family members or anything like that?
Yes, what would you like to know? Can you explain sample and what information you want to know?
Okay, can you tell me what happened before this?
She was using the restroom.
Okay.
And all of a sudden while she was having a bowel movement, trying to have a bowel movement, she became very weak, pale, and then became unresponsive. And then we laid her on the floor, so we call you.
Okay, so do you know if she has any allergies?
She's allergic to penicillin.
Penicillin? Okay, does she take any medications regularly?
She takes Zoloft, she
Okay.
takes Vasotek and Lisinopril.
Okay, and past medical
And
history?
nitro as needed, sorry.
Okay, so does she have a cardiac history?
Yeah, she has a cardiac history.
And what is that history?
History, she had an MI in the past, she has high blood pressure,
Okay,
and she suffers from depression as well.
okay, any respiratory issues?
She does have asthma, but she's now on no medication for asthma.
Okay, any history of diabetes?
No diabetes.
Stroke, seizures?
No.
Hypertension?
Yes.
Yes, okay, all right. And you know her last meal?
She had breakfast before she went to use the bathroom.
Okay, and before that she just had breakfast, came to
Correct.
use the restroom? Okay, so that's her events leading. All right, so other than that, I'm gonna take a set of vital signs now.
Okay.
While my partner is still stuck in the elevator. Okay, I have a blood pressure of 140/90.
Check.
She moaned again. Is she starting to regain any consciousness?
No, she was just moaning from the pressure of the cuff.
Okay, I'm gonna check her pulse for 30 seconds. Okay, and simultaneously take a look at her chest rise to check her respirations. So I have a pulse rate of 110, strong and regular, and her respirations I have a 20 full and adequate.
Okay.
Okay, I'm going to reassess her skin.
Still slightly cool, pale, clammy.
Okay, reassessment of her pulse ox.
Pulse ox is sitting now at 97%.
Okay, I could lower the leader flow if I want. I don't want to take her off the normal breather just yet, but I'll bring it down to 10.
Very good. Are
Okay.
you done with your assessment?
Other than transporting, I would give a short report to the hospital, and then I would reassess every 5 minutes because my patient is potentially unstable.